everyone, welcome to my channel. In this video we are going to talk about the diabetes, the treatment and lifestyle and control of diabetes. So first of all, the introduction. What's the diabetes? It's a long-term chronic condition caused by the too much glucose and sugar in the blood. So 3.9 million people affected in the UK and top 5 leading cause of death in the UK. The first country which has a more and high number of people suffering from diabetes is first India, second China, third is United States of America. The India is probably is increased in 2030 to 9 million people. In China will increase to 42 million people, and United States probably increase to 30 million people suffer from diabetes in 2030. So the part and the what type of body is responsible for the controlling the blood glucose and diabetes. The first of all, the important part, which is pancreas. The pancreas produces hormone insulin and glucagon within the islets of Langerhans. So the 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 blood sugar is increased in case of any problem happening in this gland. We can see it in the here. The picture is showing that in the gland we have alpha and beta cells in islet of Langerhans secrete the hormones into the blood. So the two type of hormone which is released by the pancreas, first of all, alpha by alpha cells produce glucagon and beta cell producing the insulin into the bile duct, then into the small intestine for the digesting the blood glucose. So how the blood glucose controlled? This is very important. The glucose obtained during the digestion transferred from the intestine to the blood and delivered to the cells. So glucose used to energize reactions or stored in the form of glycogen. So normally blood glucose level are controlled by the insulin released from the pancreas. So when the blood sugar is high, the insulin is released and bind to receptors on the cell, triggering the uptake of glucose. So when blood glucose fall, the glucagon is released from pancreas and cause the release of glucose from the organ, for example liver. So the high blood sugar promote insulin release. So the insulin stimulate formation of glycogen stored in the liver, and so in case of the low blood sugar promote glucagon release, which is stimulate breakdown of the glycogen and to glucose. So what the symptoms of diabetes? The main symptoms of diabetes are feeling very thirsty, producing excessive amount of urination, tiredness, the patient feels tiredness, and weight loss and muscle wasting, loss of muscle bulk. So genital itchiness and fungal infection and candida or thrush. The main reason is because of diabetes and immune system. Blurred vision is caused by the eyelids becoming very dry. So cramps, abdominal pain, and another main symptom is constipation and skin infection. So how can I prevent from getting diabetes? So there are some steps you can take to prevent or delay the diabetes, such as losing weight. If you are overweight or obese, achieving a healthy body weight is very important. So second is by eating a healthy diet, which is also very important. In the second slide we will talk about the healthy diet. The lower in sugar and carbohydrate diet is very important for controlling the blood glucose. The another important prevention is exercising, may increase your insulin sensitivity and keep your cholesterol and blood pressure under control. So the last very important prevention is smoking. No smoking if you are a smoker, And the last one, eating fibers may also slow down the absorption of sugar and cholesterol and make you feel full for longer. So the diet which I told you, the very important for diabetic food list, which is you can take it during the diabetes, and it's very healthy food. You can take it like a fish and cheese salad, but it's not good. Snake and fried food not good at all for diabetes. Water and green juice is okay, it's normal to take it, but soda and fruit juice is not good, which is harmful for diabetes. The fresh fruits is healthy, is good, you can take it, but the bread and bakery products you have to reduce because of carbohydrate, which is increase the diabetes, increase the blood sugar. So lower carbohydrate cakes important. You should not take carbohydrate. Sweets and cake is very bad. You have to be careful. Sugar-free ice cream you can take it, but the ice cream with sugar you cannot. Real meat is you can take portion and less amount, but the processed meat is not good at all. Vegetable pasta you can eat this, okay, but pasta with the meat is not okay. Burgers without bread sometimes okay, you can take it and you can eat, but not too much. Burger and fries is not good and healthy for your health and diabetes. Second part and the last part of this video, I'm going to talk about the treatment of control of diabetes. The first, we have two types of diabetes: diabetes type 1 and treatment for diabetes type 2. So diabetes type 1 involve the insulin injection. So in this case of diabetes type 1, the patient should, it's compulsory to take the insulin injection, insulin hormone by injection. The using of insulin pump, frequent blood sugar check, and carbohydrate counting is important in this case. But in the second type, which is type 2 diabetes, mainly involve lifestyle change, monitoring of your blood sugar, along with the oral diabetes drugs, insulin, or both. So the medications for use for lowering blood glucose, the first of all is metformin, which is very important. Reduces the amount of glucose that the liver releases into the bloodstream and increase the amount of insulin secreted by the pancreas. So second type of medication, the doctor should prescribe this medication. So this requires prescription. Second type is sulfonylurea. It helps to blood secrete the more insulin. For example, glimepiride, and the brand name is Amaryl. So the third type of medication, thiazolidinedione, make your bodies tissue more sensitive to insulin. So the brand name is Actos. The generic name is pioglitazone, which is also present in the pharmacists require prescription. Last type of medication, which is also very important to treat the type 2 exactly diabetes, DPP4 inhibitors help reduce the blood sugar level but tend to have a very modest effects. For example, including sitagliptin and Janova is the brand name. So in this video, I just try to comprise the very important treatment, lifestyle, and control of diabetes. I hope this video is useful. Please don't forget to subscribe my channel and like this video. Thank you very much for your listening.